We are thrilled to be joined by Lisa Paul, who is the co-creator of the Death Deck. And I know you IDLM students all know what the Death Deck is. It is the most amazing tool. They also created the End of Life Deck, which I love personally because it deals with advanced care planning. These are games that inspire meaningful conversations on what matters most in our lives and in our death. Lisa is also an expert contributor for Help Text, which provides great expert and mental health support via text messages. She is a licensed clinical social worker with over 17 years of experience in hospice and 7 years in emergency medicine. Lisa helps people cope with illness, dying, and grief. She has a passionate belief that peace at the end of life begins with these meaningful conversations. She engages people to talk about and prepare for the most important stages of their life.
Thank you for that great introduction. I appreciate it. You might notice that I'm not alone in the screen, and we'll get to that in just a minute. This is my dad, Ray, and he's going to be joining us. We have interrupted the regular scheduled programming to provide you with a topic that I think will be really beneficial about the patient experience. As Pam mentioned, I am the co-creator of the Death Deck and the EOL Deck. As IDLM members, you've probably taken a course on how to use these tools to facilitate meaningful conversations on end of life. Just a short little summary, our Death Deck is the one from 2018 that has 112 questions. We use this for community education, engagement, advanced care planning. There's a lot of humor in this deck, and so we don't typically use it as often with patients that are approaching end of life, and that's where our EOL deck comes in. This deck is specifically to help people with end of life preferences, and the tone, instead of being dark humor and light, is a little bit more sensitive. This is the deck that I'm using with my hospice patients. So instead of just talking to you about the Death Deck, how it developed, and all these things that you may have already heard before, I decided to do something a little different today, and I'm going to interview my dad, Ray, about his recent patient experience. He has been going through a health crisis for the last couple months that culminated in a couple surgeries and a recent hospitalization. He just came home Thursday, so everything is super fresh. I'm here in Michigan, helping out right now. He's doing great. He's been a cave dweller for a while in the basement because we couldn't get that to happen until now. Things are on the up, but it's been a long road. And I thought it might be helpful as people come into the doula experience having different degree of medical background, history with your own health, history of health with others. And I just wanted to talk a little bit about the state of healthcare and how doulas and healthcare advocates can really be participating to help people like my dad perhaps get better care than he did receive recently. So first, this is my dad, Ray. He is a retired farmer and truck driver. He lives in northern Michigan. We won't get into too many specifics because we aren't trying to tattle on people today. We're just trying to talk about the state of healthcare, especially in rural communities, which I know a lot of you are part of. First, I'm going to set the stage and talk about the illness that my dad's been dealing with for the last 30 years. When I was 19 and he was 42, he was really sick and we didn't know what was wrong. They finally diagnosed him with hairy cell leukemia, which is a chronic, ongoing leukemia that people tend to just live with. But at the time he was really sick, we didn't know how he was going to do with the chemotherapy. He then had treatment again in 1998 and 2006. And then since 2016, he's been living with these really low blood counts that makes everyone afraid of helping him with surgeries or tooth removal or any of these things because his platelets and neutrophils are so low that people have been hesitant to provide him care in those ways. So first, I want to just talk to you, Dad, about what it was like when you got the hairy cell leukemia diagnosis. And how do you think that the diagnosis changed you and your perspective?
First of all, I think, as with any cancer patient, because I've talked to numerous ladies with other men, and the first thing that happens is just terrific fear and why me, and just all this overwhelming fear of what's going to happen or what will happen. And after going through it 3 or 4 times, I still have those fears, but I can put them in a box, make them in that box livable. So I think from the start to the finish is just a progression of being able to handle it. A limb or something that doesn't work right, you live around it. That's basically that part of it. As far as how it's changed me, I had a temperament. I was driven to the point where my health was suffering because of 3 hours sleep and getting this done and doing all this stuff and not avoiding or not enjoying wife, family, and other things. And progressively, that has changed. I'm still dealing with the go get it. I'm still dealing with dwelling on things and everything else, but I managed to know my weaknesses and work on trying to get a better handle on those situations. That's basically where I am now.
And I'll tell you that my dad or I might tear up in this conversation because this is all very vulnerable. And I really appreciate you being here and
Yeah.
talking today. He wanted to share his story. I just want to make it clear that we talked about different ways to do this, and he was wanting to share his experience, thinking it might help other people. I'll say that what I experienced watching my dad after facing this diagnosis and over the years is I saw a shift from a focus being on work and getting things done to a little more of a balanced perspective. He was focused on relationships, including
Yeah.
with my brother and I. And then when my son was first born, I live in California, and my dad called every day for 3 years and for me to put my phone up to the ear to say goodnight to the big guy. And so what we saw as a family was a softening of him and this kind of understanding that we're only around for so long, and what do we have to show for it? It's usually those relationships that we have with people that leave our legacy more so on how many miles you drove your truck.
Yes, agreed.
Mhm.
How many trophies in your case? I'm a runner, and I've had hundreds of running shirts, and I'd put them in the closet and not wear them because, oh, I save them. And then you pull them out of the closet and realize that, guess what? After you're gone, you'll probably go to a yard sale or get cut up for rags because they're only valuable to you. So no, oh, I have my Jimmy Buffett shirt on today, but I wear my running shirts every day now, and my grandkids that can wear them are wearing them. Basically, realizing that you're not around here for an eternity, and you need to share your stuff and the valuable stuff that you feel is valuable with your family. So,
Mhm. We grew up on a farm, and death is part of life
mhm,
on the farm. And
agreed.
so we grew up with that comfort level that I think helped me, as well as a little bit of a dark
Yeah.
sense of humor about
Yeah.
it.
Oh, yes.
I was always being threatened to be cut out of the will if I didn't do X, Y, or Z.
Yes, that's true too. Sorry.
And how do you want your remains spread?
I live within a mile of where I was born, and I'm going to take my ashes when there's a load of commoner. I'm going to dump them on.
Now, we've talked about human composting, and that's the suggestion that I've made since we all know that the cremated remains are not really going to be beneficial for the crops. So, this has been the kind of the history with his leukemia. And so his illness, his counts have been a big portion of our family system here
Mm.
for 30 years. How's dad's counts? He goes to the oncologist. It's this wait and see. Through COVID, it really did impact him greatly because, and even before COVID, there was a lot of fear around germs and him being able to fight off infection. And after this recent health crisis, we've been talking a little bit more about the fact that he's 71 and maybe we stop living in fear of those germs.
I need cataract surgery, and oncologist is telling me, "Oh, cutting your eyes open, they could bleed. You shouldn't do that." Guess what? I think that's worth a chance because I would like to see better than I do. It's not terrible, but it is restraining. So I think we're going to go with that kind of surgery and get it done.
And I bring this topic up because I think this is something that people just don't know until you're in these kind of situations, just how much living with a chronic illness, especially a chronic cancer, impacts both your life and also the care you receive, who's willing to treat you. And again, he's in a rural area, and so the amount of options there are for providers is very small. It has been an ongoing challenge, but he's been navigating that. So now we're going to talk about the most recent crisis and why I'm in town. So I'm going to try to summarize it. So in mid-August, my dad went for a run. He at 71, still a runner, and he was pouring cement that day as well. And he was really working this knee that's been ready to be replaced. And the following day, he woke up with all of this extreme pain. Wasn't sure wasn't what was going on. We weren't sure if somehow the leukemia was causing bone pain, if this was something different, what was going on. Eventually, after the pain becoming worse, you ended up in the ER where they misdiagnosed you with a Baker's cyst, which a Baker's cyst is supposed to just go away on its own. It's supposed to be no big deal. They refused to drain it in the ER because of his low counts. So they just sent him home. So the pain continued.
Mhm.
You made it in to see one orthopedic and they drained it and they gave you a cortisone shot because they said Medicare isn't going to pay for a knee replacement until we wait 3 months after a cortisone shot. So we have to give you a cortisone shot now, and then we're going to send you home, and then we'll talk again later.
Yes.
The doctor gave you a handful of pain meds and then said, that's it. Yeah. So what was that experience like?
I would say I have never experienced uh, that in kind of pain or situation and hopelessness in my entire life. I can't describe it. It was a striking jointed pain in the knee, and it would just basically, I walked around here with a wash rag on the corner of my mouth or a football guard just to try to keep my teeth from being chipped because I would just grit the teeth. And my wife was calling around, and it's there's nothing wrong with it. You got a stomach, it'll be fine. And it just kept getting worse.
And you went into the primary,
Yeah.
and what happened then?
The primary way in, I actually stood there. I couldn't sit anywhere because it would just drive you up a wall. I went to the primary, which I will say real quickly is I'm an old farmhand. I had the leukemia covered with the oncologist. I was healthy. I was going in once a year for my physicals. So I had no really based health care primary provider. And so when I went to see the lady within the office that I visit, she took me and looked it over. And in fact, I stood by the one of the little tables there, and she was standing there. And I said, "You better hold me up because I'm going to faint." And I did for about a second. And that seemed, they felt really sorry for me. So she gave me, I think,
14?
14 of the Narcoal, and then told me that I was overdoing the Tylenol. So we come back not knowing what to do. And of course, without a base for the narcoler, it did the job, getting it down a little, but it didn't do anything that way. And then when I called over there to s- tell them that it wasn't working, they just said, "You're not getting any more of those pills." That's
Mhm.
then I sat around here and we struggled, and just happened to have a neighbor who worked for as a assistant for one of the operating people, orthopedic, and he went and stopped and talked to this gentleman, and the gentleman had me come right in. And a short story on Wednesday, this was Friday. On Tuesday, he explored the situation in there, found out that there's the the arthritic part of it was just tore it all up. There was meniscus was torn a couple spots, and it was just total disaster in there. He cleaned it out, and at that point in time, it was dry. He said, "It's dry." And out he came and said, "Well, plan." And all this time to go back, the leg, knee, and the foot down were so big that there was no way you could put a joint in. So we came back home and lived with it because
Mhm.
the ends still of severe pain. And at that point in time, they started me on PT.
Mm.
And going to PT was, I was doing everything. And finally, after about 10 sessions, the PT people said, "There's just something wrong in there. You shouldn't have this incredible pain." So then we started pushing things. They have a great primary now. She pushed things. And finally, the scope hole that was in my knee opened up. And here comes the staph infection, came running right out of the hole. And
Mhm.
so we took the picture and sent it in and found out the knee was full of staph. And then from that point in time, it was a hospital, open up, full clean of the joint, wash everything, bleach. And now I am on antibiotic for 30 days. And hopefully that will take care of the staph.
And during that time, I'm in California and I'm talking to him every day. I was able to get one of our friends to take over his care as primary, which helped dramatically because now she was willing to prescribe pain medication for him. And then she had him do the kind of emergency MRI
Yes.
that then resulted in the immediate hospitalization last week. But during that time when I was talking to my dad, it was excruciating because I was in California. Everyone he's talking to is just telling him to live with this kind of pain. I have worked in healthcare. I'm understanding that this kind of pain is not normal, that you can't just power. This is a farmer. This man powers through everything. He ran until he was 71 on a knee that he shouldn't have been running on still.
Yes. Okay.
And yet no one would listen to him, and that's what he kept telling me.
And it's just a, yes. Oh, I cannot imagine someone who is living alone with chronic pain, sitting on a couch trying to watch a show with the pain just excruciating. I just think that there has to be a way to safeguard for these. Um, I don't care who it is. Just the dignity of life says we cannot let somebody just be filled with this kind of pain and say, "Oh, live with it." So
Mhm.
there's where I'm at now.
And I will note that Michigan has some of the hardest
Yes.
restrictions on opioid and other Class D medications, and so it is the suicide rate in Michigan has increased with these laws in effect that are supposed to be curbing addiction, but for people with severe pain are denying access to medication. So that's a whole other topic that we're not going to dive too far into, but my dad and I feel pretty strongly about that one too.
Yeah.
Um, but that's the stage for how this all became is everyone is afraid of prescribing medications, especially to someone over 70, even though this is not your typical 70-year-old stuck with his fortitude and working 12 hours a day. So when they discovered that
Mhm.
there was a staph infection
Mhm.
that was in there
Mhm.
weeks, if not months,
Yeah.
which we get varying.
Yes.
The infectious disease says there's no way it was in there the whole time. The orthopedic says it might have, I think it might have been in there in that first time we went in there. So we're not exactly sure when that started, but the orthopedic, when he went in to clean out the knee, he did not take a sample. And so there was no testing for an infection at that point because it looked good. And he lived with that pain just being told. And with my dad, who has this fortitude and that I was raised with, if you work hard enough, you'll get it done.
Exactly.
And so he was working his little tail off trying to participate in PT, trying to just get through the
Mm.
day, thinking it's bound to get better, but it just kept getting worse. So when you learned that there was a staph infection in there, what was your original thought?
For the last 2 months, we would get small rays of hope, and then they would be there for a short period of time, and then some shoe would drop from another direction in every situation. When I got the news of the staph infection, at that point, I actually cried and said, "I don't know if I'm gonna take this." But my wife and I were just totally engulfed in all the fears with staff. Anyway, after we got in the hospital and they take the thing out and put a spacer in there now, and I'm gonna go through this whole rigmarole and then go back and have it cut open and put a regular knee in it. So there's a little
Fear.
anger inside of me that all this second time stuff is going to have to be done. But the pain is there's pain from the insert, but there's without the pain, my mind's starting to come back and focus. I can read, I can write, I can look forward to games and stuff like that. It's been a real positive. It's only been a week and it's been a very positive week. But and in the back of my mind, the way I'm thinking, please don't drop another shoe.
Going back to your hospital stay.
Yeah.
So you were in the hospital from
Yeah.
Saturday,
Mhm.
Saturday or Friday night? Friday night
3 in the morning.
to when you were discharged this
Yeah.
Thursday, so almost a week. Um, can you tell me what I saw was a wide range between the professionals coming into the room.
Mm.
And I'm sure anybody who has been hospitalized or has worked in a hospital setting understands this, right? You have some hospitalists that seem to really be invested and others that not at all. Nurses are the same. Dad, what was your perspective of the difference in the care that you received and w who were you happy to see?
I classify the health uh, situation in the hospital like this. You have people who have done it for years. They have developed a special way of dealing with people, and it's in a smiley way, and they do their job efficiently and everything else. And then there's the ones that come in and they're just bubbly people and they're fun and they start joking with you and you get used to those. And then the ones who don't want to be there, they throw the covers over you. They don't make sure your feet are covered. They handle you not rudely, but roughly. And that is about the spectrum of things. With the situation in the hospital, we had a board there where nurses would sign in on the wall and tell you who they were, who your primary was and who the helper was. But some of them would change in 2.5 hours. Some of them would be all night. And it just, there was no, they were changing staff to cover things understandable, but it still was very disruptive, even at night to sleep. And then a lot of times at night when you're getting blood drawn and blood pressure and all this stuff done, um, it was a random times, an hour hit this hour for blood, this hour for blood pressure, then this, and then pain pills. And so if you were fortunate to get to sleep and sleep, you weren't going to be there for more than an hour before somebody was poking or prodding you. That's the situation that I think, I don't know. maybe there's no way to correct that, I'm not sure, but it was very detrimental to getting any kind of rest.
I know healthcare systems have staffing issues,
Mhm.
and so that is happening, but how it impacts the patient care is that we have a lot less trust for these nurses who come
Yes.
in and they basically say, "I'm only here 2 hours." Basically, I'm not gonna this is all you're getting from me. You're gonna get these medications. I'm only here 2 hours, and then the next comes in, and I'm here 3 hours, and so it's hard to develop trust as a patient, and my mom and I are in the hospital during the day, and then we need to leave at night and wanna make sure he's gonna be receiving good care, and it's hard to be assured of that when there's just a rotating door of people coming in.
Okay.
And I think also what we saw were some people listened to you and other people acted annoyed and left the room while you were talking.
They would tell you in my situation, you gotta have a belt around you to go to the bathroom. They put the belt on you, and then you get up and you walk to the bathroom, and they're supposed to walk behind you, not necessarily hold on to you, but be there to do that. Then you get in the bathroom and they shut the door on you. Some of them would just go do other things, and I'm not standing in the bathroom for 10 minutes waiting for somebody to grab me. So I'm back to the bed with the strap on, which, in all intents purposes, avoided the whole situation with the belt. The one thing I will tell you is this kind of will summarize how some of the things work. So all the beds are weighed. You weigh off the bed, but and I was not ever weighed on a regular flat scales. But the one of the first people to write us weight off that scale bed, I heard them discuss about taking the weight of the pillows and the blankets and stuff off. Then after that, these people were just going with the bed weight. So now we get down the line ready to come home, and here we have this one weight measurement that's 6 or 8 pounds under the rest of it, and now they're trying to figure that has to be wrong. What's going on here? One mistake or shortcoming made a whole lot of testing and stuff to check before I could come home.
And the reason was with that is because I'm now looking at all of his labs and everything every day, and I'm seeing that he had a 10-pound weight gain, which is suggestive of pretty dramatic increase in inflammation and fluid. And
Mm,
so we shouldn't be sending him home if he's really had a 10-pound weight gain. Again, there's these moments of inconsistency that we know happen because humans are humans. If you it was me who brought that to the attention of the hospitalist, this weight gain. No one else was really looking at the
mm,
fact that he had this tremendous weight gain and trying to get to the bottom of it. And our whole purpose of kind of talking today not is first to just give you a real fresh, vulnerable look at the patient experience in 2024 being hospitalized in rural America. The other thing is there's all these entry points for there to be health advocacy and support. I'm fortunate enough to have all of my experience. And
mm,
again, we were able to rope in one of my friends who was able to do things way outside of the typical primary role, who have filled in as a doula healthcare advocate. Like my dad was
yep.
saying, had he been alone, had we not gotten to this point, he might still be suffering.
Yeah,
He might be dead
yeah,
with the staph
sepsis.
infection if we hadn't gotten my friend involved
Yes.
because no one else was listening to him.
Yeah. It literally had to come out of a hole in my leg and run down my leg before somebody would listen. Now, you can healthcare, you could prescribe or think of any other issues and stuff on how they diagnose this, but I really do not think in any shape, form, and everything, I should have had to wait until it started pushing out of that hole. I was living fine, so I had no circle to have a primary. I have an oncologist, and then I had the other situation going, but I had nothing in this circle to hold them together. And some of the people of like the cancer and the ortho are they're fine surgeons and everything, but they don't return calls. They don't communicate with my primary, and she's got to fight with them. It has to be people who have to spend the time and research. Somebody has to, in some shape or form, step in with these people and at least get the circle of care going for them
Mhm.
with communicative, with people who will communicate and work together and help them, whatever situation they're in. If we do not, it's just a travesty to the human experience. That's what I fully believe. That's why I'm here today to say, in my little part, nobody should sit in their home, a chair, biting their tongue with a wash rag or something in their mouth, trying to get through pain. Yep.
Yeah. And yeah, my dad and I have had quite a few conversations through all of this. And I think the theme that keeps coming up is the human dignity, right?
Oh, yes.
Mhm.
Gosh. I don't care if you live on the streets, and I'm not saying that's bad or good. We have a core human value. And when we don't respect or at least try to help people to stay in that core human value, we have failed. So, and I don't know how I know the expenses and people don't have money and the doulas and all that, but somewhere there has to be a key to figure out, at least the principle, how to alleviate and get some of these things taken care of.
We started the Death Deck in 2018, and I've been doing lots of talks since, completely
Mm.
changed our family system. And I like to talk about that. But to be able to talk with you today and here, and for us to be doing this together is really special. So I was
Very
very
special.
glad that Anna and Pam agreed to this. Um, so if you were going to hire someone, if you didn't have me and our other person, we're specifically trying not to say names here.
Okay.
If you didn't have us, or if you were on your own and you needed to hire someone, what would be the characteristics of that person that you personally would be looking for after going through this?
I think not a giggly sense of humor person, but somebody who might come in and say, I like your shirt or lighten up the room. And then being detailed about what's going on, honest, and doing all the factual stuff that you need to do to get things working, knowing that you got to make a living, so you can't sit there for an hour or two, but the 5 or 10 or 15 minutes that you're there can be used to open conversation and get the stuff going and warnings and good things and bad things. So just an all around nice person who basically likes to do what she does and helps with the things that it needs to be done.
Coordinating.
Yeah.
Now, doulas do spend more than 5 or 10 minutes, so
Fine.
they give you more time. But the other thing that we talked about when we had talked about
Mm.
this prior was someone that was not afraid to stand up to the healthcare
Exactly.
professionals.
Oh,
Because I think that's one of the things that my dad learned through this process is that there were a couple times he got pushy and he pushed back, but most of the time he accepted them as the experts and professionals. And when he knew deep down that something more was wrong.
yes.
And that's how we got on the topic of the healthcare advocacy. And once I got to the hospital, I may have made a few, not enemies, but one individual wouldn't come back in the room when I was there. And I think that's how you have to do it when you're advocating for somebody, because there are people who will just do the bare minimum. And when you're sick, and you are scared, it's hard to advocate for yourself, right? It's
Yep.
hard to
Yep.
you almost don't care, you don't have the energy, you can't even think clearly.
Right. Oh, no, that's totally true. I journal every day. Okay. Have journaled for uh,
Since
since
your diagnosis.
just cancer in 25 years. In fact, I have 3 grandkids and I write on the top of every page, thank you and help them. And I can usually write clearly. It's not any great penmanship, but it's clearly. But when I was struggling with this pain and stuff, I had a hard time just keeping concentrated on the signing, and there was no long term reading. I had a hard time fighting watching TV programs. I didn't want to play games. It was just this cloud. And now plus the fact that you get no rest. If you get an hour sleep before you bump it and it drives you up a raw, you're lucky. So I was sitting in that chair here, maybe getting an hour's sleep, maybe not, and then going up and back to the bathroom, and it was not good.
Yeah, he looked horrible when I arrived. I got here on Sunday, and he had just come back from the operation, and he looked so sick and so old. I really wasn't sure he was gonna make it through this. And it's a week later, and
Mhm.
he's doing tremendously, and we are doing his PT, and we've got the IV hooked up, and we're doing all the things, and so that's how we're able to talk today because things are improving. Obviously, I wouldn't put him up here if we were, still struggling like that. But I do wanna open it up to questions. See, I haven't had the chat open. I'll see what we have in here. I know some people are sharing their experiences, which we appreciate. Um, but does anyone have any questions for either of us or any comments that they want to share?
Mm.
Ooh, okay.
In the chat.
I see a couple of hands.
Uja.
Anuja. Yes. Hi, Anuja.
Right. Thank you so much. This is as real as it gets, right? I guess my question is I don't have a medical background. Of course, even for a person like you, with all that credibility and all that experience and the medical background, you probably ran into challenges. Probably there were walls, probably there were barriers. I was just curious what your thoughts are on how much of a cloud can a doula have in this situation with the medical team. Um, we don't speak that language. We probably don't understand all of the things. And so we can advocate to a certain extent, but we don't understand all of the intricacies of what's required in testing, diagnostic, blah, 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 blah.
Right.
Just curious how much influence and how much success can we expect to have advocating for our patients in these kinds of difficult situations?
Personally, I think that every doula is coming in with your own experiences and your own background. And so some people who are coming from a medical background, I think are probably more prepared to be in this kind of health advocacy role. I think other doulas without that background are probably most beneficial in the supportive role, in the being willing to be a facilitator of communication and emotional support along the way, helping to facilitate trying to get the doctor to call back, those kinds of things. I do agree with you that I've worked in the medical field for almost 18 years now, and so I have enough understanding to be able to advocate more than people without that experience. But even in this experience, I don't know orthopedics and I don't have experience in that. And so I kept saying as I was listening to him on the phone, I wish I knew more about this. I wish I had worked at a time on a or surgical floor to have a better understanding of how out of the normal this is. So there are limitations. I agree with you. I think that if you don't have the background, it's a little bit harder to know what to look for in those things. But like everything else, the more experience you get, the more kind of understanding you have. But I think that for people who I've met quite a few doulas who have come from a nursing or a social work or even a hospital chaplain background that kind of have a general understanding that can slip more into the advocacy role. But there are limitations. I think even just being my dad and I have talked a lot about the fact that my mom's amazing and she's a wonderful support. And and a good advocate for him. But she didn't really have any medical background,
There you
and they felt like the blind leading the blind. And
Exactly.
so I do think that in some ways there has to be
Yeah.
some medical background or some understanding
Yeah.
to be able to advocate fully. We can all tell when something doesn't seem right, and we can gather information and try to help empower the
Mm.
person to say, you need to keep calling your doctor every day until they do something. And so coaching people and empowering people in their health care, I think, is another way to do it.
I'm going to piggyback off what you just said, because the other thing is people like your dad was there. He was in incredible pain, can't think straight. They may have came in and said, do ABC, and he heard DFG. And
Exactly.
they're not hearing the conversations. Even if you're not a medical background or you don't have a lot of doula per se experience, if you can listen and you can ask intelligent questions and you
There you go.
can, this is what is important. And a lot of the doulas that come into this practice do not have a medical background. They come into this practice from the experience that you've just gone through with your dad.
Yeah.
I'm sitting here going, oh my God, in my head, I'm screaming, especially since, God bless him, I've had both my knees replaced. I walked bone on bone. I don't see how he did what he did. Incredible strength to get through that.
Yeah,
But,
well,
but, but having an advocate that could ask, why is he in so much pain? We
Yeah.
don't know. Then what can we do to find out?
Mhm.
Don't have to be a medical professional to do that. Don't have to be a medical professional to say his pain level is not being controlled.
Mhm.
Got to control his pain level. I
Right.
I had a client that had a pain level that was off the chart, and they kept worrying about opiate addiction. The kid was dying, for God's sakes. Opiate addiction was the last of our concern. And
Yeah.
Agreed.
not taking no, go away, and we can't do, they finally listened. They finally got what we needed to control his pain. And the man was able to get some peace. And just like Lisa's dad was saying, this guy hadn't slept in 4 days because he couldn't get his pain regulated.
Mhm.
That's not human.
Nope.
And you were able to step outside that pain. What would you be doing? Be that person for that client. Be that person that says, no is not an answer. I don't know is not an answer. Get me someone that can give me an answer. And I love it, Lisa. You said you made some enemies. Let me tell you what. I ask for forgiveness all the time. I've got so many enemies that it scares me to death. Not because I'm there to take care of that patient. I'm not concerned. I go in telling the patient, I'm here for you. If you don't want me to say something, tell me to shut up. If you want to handle it, I'm a bear. I am like, I'm going to take them by the shoulders and sink my teeth in until I get the answers. You don't have to have a medical experience to do that. I can tell you, although I've done this work for 45 years, I have no medical background. I have learned it from asking questions, from listening to the conversations in rooms, from being present and a doctor saying, we're going to do ABC, and me going, what does that mean? And making them explain the process. And thank God for the internet, because when I started, I had to go to the library to look crap up. Now I just have to pull up my phone and say, oh, okay.
Yep, Dr. Google.
Yep.
Carrie, it looked like you have your hand up.
First of all, thank you so much, Lisa. You and your dad sharing your story is one that I think is valuable for everyone. I've been a speech pathologist in acute care and worked in a cancer hospital for over 30 years. And a lot of what I've learned has not just been with my day-to-day patients. It's been when I've had family members who have gotten sick. And like you said, my background's not in orthopedics. My dad had a lot of cardiac issues. So I learned about the cardiac system. And so it's those things. But I agree with you don't have to have a medical background. Yes, it's super helpful. But Pam was saying, asking the questions. I think we talked earlier about with doulas, we sit down and we talk about your advanced care planning and directives and ask those questions. So if you know the human being, you can advocate for that human being because ultimately you're keeping
at the center of the conversation what's important to that person. And in your dad's case, it was managing his pain to get back to functioning. I think far too often we dismiss things as, oh, you're just getting older and you just have to live with it, or you've got this diagnosis and this is just how it is. And yes, while the burdens of the medical system are what they are, the more that you press, the more you can get information. I would suggest in some cases, I hear a lot about sleep, and I tell every patient's room, everyone I go into, I say, ask if you can have your cares bundled. It's one of the best kept secrets. If you don't have to have time sensitive labs or anything. If you ask them to put a sign on the door saying, please do not disturb between the hours of 12 and 4 or whatever you can do, then that can at least give a consolidated amount of time for that person to rest. I understand that sometimes that isn't possible, but it's 100% not possible if you don't know to ask. So I always say, ask if the cares can be bundled. Ask if there's a time where you can have rest, even if it's during the day. When we go in to do therapy, it may be the time we have, but also we have to have that person be at a place where they can accept what it is we're needing for them to do or how we can support them.
Those are great suggestions, Carrie. I really appreciate that.
I wish they would at least offer me that option at least one part of the day because it would have helped immensely.
They don't. We're not trained to do that. Like I said, it's the best kept secret that I refuse to keep secret. So everyone I can tell, I tell.
Yes. I know we're just about out of time. I wanted again to thank Anna and Pam for letting us change the script here and have a different conversation. Of course, if you want to reach out to me and chat more about the death deck, I'm happy to send more information to any of you. Again, I put the discount code in the chat box. That is an ongoing code for IDLM participants. And I welcome anyone reaching out. And I just want to thank Ray, my dad, again, for being willing to do this with me today.
Let's get
Amazing.
it. I know it's a long road, but there has to be some way to, at least with our old and aging population, to make life more dignified. Yes, just needs to be done in some way, and I don't know how.
But that's why we're here
Yeah.
today.
Yes.
What an
Lindy?
amazing job, Lisa.
Thank you. Thank you, everyone.
So
Yeah.
much.
Thank you very
Lindy
much.
has her hand up.
Lindy, yes.
I just wanted to say it's very frustrating and disturbing for patients to have to get to a point where they're in hospice to be able to receive the kind of care that they deserve to receive, where we do those kinds of things. We advocate for them and we go the extra mile for them to get the pain. And even when your dad was saying, like, even you get making comfortable pulling a sheet over their feet and things like that, that in the hospital they just don't do. And I'm sorry, but I've been a nurse for over 25 years. There's no excuse. I don't care how busy you are, how tired you are, how much you hate your job. If you hate your job, quit. My own experiences with my late husband and with my career and so forth. And you're right. We just have to do better. I'm not sure how either, but I think whether you're a doula who has medical experience or you don't, I think advocating for people individually, like Carrie said, when you know them, but taking opportunities to advocate wherever you can, really. So I don't think anything's going to change unless we do that. So
Very well said.
Yes.
Thank you. Thank you. And thank you I'm sure that you're an amazing nurse who provides such compassionate care. And that's what we can do too, right? We can be the change.
Right.
We can provide the care that we want to see others provide. We can model for other people how to treat people respectfully and kindly and
Right.
compassionately and ask for their preferences and all these things. And Pam said, and then we can be a bull when other people aren't doing the same.
And that, and like the dad said, there are people in the hospital, nurses and doctors and so forth, who are caring and do that. But
We
there's
definitely
not enough.
We had some awful rock stars when it came to jumping in and spending 8 or 10 minutes and explaining everything and making us feel respected and like we were intelligent enough to understand what they're saying. And that is probably the best gift I think any patient can get is just respect enough to tell the truth to them and give them the time and stuff so they feel valued. So
Agreed.
Well, that's
Thank
a
you so
great
much, yeah, for
ending.
sharing your story today. I really appreciate it.
Yes, I'm hoping in some little way it will help things out, or at least put a little bit of a light on what we need to do for us old people.
Yeah, we're not quite ready to say elderly, and I agree, but those are people that are a little older. I know we're cutting into the next speaker's time, so thank you again. We're going to jump off and go do some PT. Thank you, everyone, for your time today.
Thank you for sharing your story and
You
just
bet.
bringing such great insight to all of our doulas here.
Okay.
Thank you. Bye.
You.
Hey. All right, Miss Anna, I think it's lunchtime. What do you think?